you ever felt blue, sad, unhappy, or miserable? Have you felt lost, angry, or frustrated? Have these things ever interfered with your everyday life? My name is Monica Hinojos, and I am going to talk to you about different types of depression, symptoms, and ways to deal with depression. Many people live with depression but do not understand or know how to deal with it. After experiencing my own daughter's struggle with depression, I will be educating you on certain signs and symptoms of depression and ways to help you or your loved one through it. I hope this speech helps you to better understand how to recognize depression and how to help yourself or someone else with depression. First, I will discuss the types of depression. There are several different types of depression, but there are 4 distinct depressive disorders which are more commonly known, which symptoms either cause significant distress, impairment in one's school or their work, or relationships, and which are not caused by a medical condition or substance like medication or alcohol. The first one is major depressive disorder, also known as major depression or clinical depression. The second is dysthymic disorder. The third is manic depression, or also known bipolar disorder. And the fourth is minor depression. Now that we know the types of depression, we will view the symptoms of depression. Although there are common symptoms within the 4 types of depression, there are also different symptoms which contribute to each of them separately. Major depression, their symptoms are weight loss or gain, difficulty or increase of sleeping, also fatigue or loss of energy, the feeling of worthlessness, difficulty thinking, concentrating or making decisions, and repeated thinking about death or suicide. And with dysthymic disorder, the symptoms are similar. It's also decrease or increase in eating, difficulty or increase of sleeping, low energy or fatigue, also low self-esteem, difficulty concentrating or making decisions, and hopelessness. In the case of manic depression or bipolar disorder, that consists of inflated self-esteem or self-importance, also the decreased need for sleep, and more talkative than usual, or they're compelled to keep talking. They also have racing thoughts or ideas, and they are easily distracted. Increase in goal-oriented activity, whether it's socially or at work or with school or even sexually. There's also excessive movement. They're just constantly moving and restless. There's excessive involvement in potentially risky, pleasurable behavior such as overspending, careless sexual activity, or unwise business investments. And minor depression, it's similar to that of major depression. However, the symptoms do not last as long. And there are types of minor depression, like postpartum depression, which is the mother, after giving birth, feels overwhelmed with the responsibility of caring for the baby. And there's also depression, which is called SAD. It's an acronym for Seasonal Affective Disorder, and it occurs usually during the winter months, when it's winter or fall months, when it's dark and there's not much light outside. Now, we will take a look at how depression can be treated. Once depression is diagnosed, there are a couple of ways to treat it. There's talk therapy, or also psychotherapy, and those types are cognitive behavioral therapy, and it's to restructure negative thought patterns. There's also interpersonal therapy, which helps people understand and work through troubled relationships which contribute to their depression. Along with therapy, there's medication. It's another type of treatment. And there's several different types of medication. Selective serotonin reuptake inhibitors, which are known as SSRIs, and that includes Paxil, Celexa, Prozac, Zoloft, and Lexapro, which we often hear and see commercials of. There's also serotonin and norepinephrine reuptake inhibitors, also known as SNRIs, and that's Cymbalta and Pristiq, which we hear of, maybe not as commonly. And tricyclic antidepressants, as well as monoamine oxidase inhibitors, which are MAOIs. You might have heard that on commercials, is MAOIs. And finally, since we have learned what depression is, the symptoms of depression, and how to treat depression, we will discuss how to help yourself or a loved one through depression. And depression should not have to be dealt with alone, or not at all. So I think if you feel anything or you know of anyone with the symptoms that we have discussed, they should go see a doctor to seek help. No one should have to live with it just to deal with it. Many times depression is hereditary, so it's not something that we decide or we just have to deal with. Um, First is to get help from a professional like a doctor, a psychiatrist, or a medical facility. There are medical facilities that specify in the behavior of depression. And after much research with the websites, it was common that to be active and to exercise, that was one way to deal with depression, along with medication after, or therapy. Also keeping busy with something you enjoy. And a third would be spend time with other people and confide in a friend. Do not isolate yourself. Don't feel like you have to go through it alone. In conclusion, many people live with depression but do not understand or know how to deal with it. Depression comes in different forms and has different as well as similar symptoms. If we can acknowledge what the symptoms are, depression can be treated by either medication, therapy, or both. People with depression do not have to learn how to deal with it alone or not at all. It is important to get treated. You can overcome depression, especially if it is treated early. I hope this speech has given you some insight on depression, the symptoms of depression, and the way to treat depression, and the ways to deal with depression. Thank you.